Ronell Nolan, President, CEO, Health Agents for America. I'm giggling because I was probably 15 minutes into our Monday morning video and realized that I had not pushed play. I'm a week into my surgery. As you can see, I have a big cast where I got that I could type in 3 days. I must have dreamed it because I can't type in 3 days. I can't even type in 2 weeks with this big cast on my hand. I do start physical therapy on Wednesday and get my stitches out on Friday. So hopefully after the cast is taken off, I'll have a little bit more flexibility. I am responding to emails using my right hand and my phone, so it's making it a little bit easier to communicate. But if I owe you something, please, I apologize. Reach out again and just understand that this has been a lot more painful than I ever thought it would be. It really hurts. Just putting this phone up to be able to make this video, I thought I was gonna cry. So, but we're good. We're good, and the video is going. So, happy Monday. I wanted to let you know that our Department of Labor letters have gone out, and we did receive a response from Congresswoman Harshberger from Tennessee. As you'll remember, I told you she was a bulldog for the people, and we received an email back from her health policy person telling us that the letter had been sent and also CCing us on the letter sent to the Department of Labor, explaining who we are. Now, for those that have been NAHU members forever, will remember Pete Stein. Pete Stein is the Congresswoman's health policy person. So when we met with her several weeks ago, I got an email from Pete and said, Ronell, I think I saw you on our agenda. And I said, absolutely you do. So not only is the Congresswoman one of our friends, Pete Stein has been a fighter of the agents and continues to be, and will be helping us trying to get with the Department of Labor. So that's some really good news. Pete and I have worked together since way back in the NAHU days when I was a member and also a lobbyist for LAHU. So excited to see Pete's name, excited to know that he's going to help. I will be reaching out to the other folks, CMS, Senator Cassidy, all the folks that we sent letters to, that we met with, Congressman out of Georgia, Buddy Carter, everybody that we met with, I'm going to follow up, be it with one hand, because it's important that we reach out now and put some light a fire. Everything I've heard says that the Department of Labor will send out proposed rules the end of July. We need to get in front of them before they send out proposed rules. We need them to understand our concerns. You know, everything about that group piece. That group piece is very complicated. The individual and short-term part that's being promulgated by CMS, very straightforward. It's done by the insurance company. That's what the law says. It's either going to say agents are paid $10 per month for the family, or $12 or whatever it is for that state, or for some of those insurance companies that pay the big old goose egg, they should be they should have to say that they pay as a goose egg. But that'll be straightforward on CMS's side. On the Department of Labor side, very, very, very complicated how we're going to have to adhere to that law for our group products. So stay tuned. As soon as I hear anything, I'll let you guys know. Also, remember to register for the summit. By then, we'll know about commission transparency. It will be August. I will have either met with the DOL, or the DOL will have put out their proposed rules, or CMS will have put out the proposed rules. We'll have a better idea of what's going on. There'll be a full hour presentation on commission transparency. So if nothing else, you come to the summit to learn about what you need to do. Now, does it affect every one of you? Absolutely. If you don't think it does, you haven't been listening to me for the last 6 months. It does. You need to be aware. You've got to adhere to this law, because the law is directed to insurance agencies, especially on the group side. But you need to be aware on both. Not only that, the new Biden regulations that seem to be pouring out kind of like a water faucet, we'll have an update on what those are and what rules, regs, laws have been put into place and how that affects agents and brokers. So it's going to be a very intense, exciting day and a half. And a lot of fun. We're going to have a lot of fun. Hopefully everybody signs up and attends the murder mystery on the Bayou party, where people are going to come in costume. They're going to know who their character is beforehand. You'll be able to play that character throughout the whole event. And as the night goes, we'll find out who gets killed and who is the killer. So it'll be a lot of fun. It'll be a way for you to network with other agents and brokers and our sponsors. So it'll just be a fun time. Let me know if you have any problems with the hotel registration link. I know some of you have had problems with that. But I just tried it and it worked, so it should be fixed. They just hadn't put in all the rooms that we have. There's 40 total on site, so you need to go ahead and book your room to make sure you get a room reservation. We also have a agent that is willing to, for a small fee, pick up folks from the Baton Rouge airport, drive you in a motorhome, have boudin, whatever you want, Cajun, to snack on. We'll stop at the Walmart if you need to stop and pick up a couple of things. He'll do whatever you want to do, and just ask him for a small fee to cover his gas. So if you're looking for a ride from the airport, it's about 25 minutes from Baton Rouge. Let me know. We'll get that sign-in list ready and send it to Kurt Wagner. He's the gentleman that has agreed, who is a HAFA member and very helpful and wonderful to us. The other thing is, if you're looking for new headshots, professional headshots, the Nottoway facility is beautiful, especially this day, this time of year. Just the beautiful magnolia trees. It's gorgeous. Maggie Thornhill will be on site for $100. She will do a headshot. Headshot sitting, includes 15 shots. She'll also be with us through the summit, just taking pictures of the summit, so we'll be able to put that on our website. If you're interested in getting on the list for headshots, please send me an email ASAP. We'll only have time for a few before the summit, after the summit, and any breaks during the summit. So it's only gonna, be an opportunity for a select few. So you want to reach out. I wanted to let you know about a couple of things that's in the Monday morning news. One is the CMS has put out an article about healthcare.gov that CMS is again lowering the cost of health insurance and opening more pathways for Americans to obtain affordable comprehensive health insurance starting July 1st. So starting, I think that was Friday. Today's the 4th. Happy 4th of July. Forgot to say that. So consumers that are receiving unemployment for the week beginning, for any week beginning 2021 may be eligible for lower healthcare costs. So if you have anybody receiving unemployment funds now, so you might want to just go in, touch their app, see what happens. Or if you have someone who's getting unemployment and they're looking for health insurance, there'll be ways to help them. Also, there's an article from Politico, and it says what comes next for the ACA. It says the Biden administration is going to try to patch some long-lasting holes in some of the law flaws about especially insurance companies that have had a lot of claims denials and those that have narrowed the network provider networks. So it said a report earlier this year found that insurers on the Obamacare marketplace denied an average of 17% submitted medical claims in 2019. So they're a little bit late in their discovery, but they're looking for the government to be more involved, for the government to take a harder line with insurers, for the government to look to have HHS audit health plans. And you know, I'm not going to say the sky is falling. What I'm going to continue to say is that we're going to operate in the sandbox that we're given. I'm going to tell you that things are changing. The government is getting more involved in, I mean, they were already up to our eyeballs in our business, but even more as far as insurance companies and things like that. So pay attention. It's a big reason for you to tell others about HAFA, to make sure that, you know, we are bringing value to your membership, and that's for us making sure you know what's going on. There's also some growing concern over the prices insurers are charging for their plans. No one ever said the ACA was affordable or it made the premiums affordable. There are folks that just still don't get it, and the government just still doesn't get it. So they said that there's still record-breaking rebates likely for the third year by companies that did not funnel enough of the 80% MLR. So insurance companies continue to try to work in the MLR and still not working. CMS also had an article that just went out that says that the Biden administration is going to have some new plans that are new, I guess, rules that includes, back it up. These are proposed rules. So proposed rules by CMS, and we'll see how they, you know, roll out, which we know probably 100% is going to go into effect. The first one being that 2022 will have an additional 30 days to enroll folks in the open enrollment. So those working in the open enrollment need to pay attention, need to be prepared. Also, those that are in the small group market, I keep telling you, get involved, get ready to sell in the individual market, because those under 50 are going to start looking at their plans. And because of all the money funneled into the individual market, because of the American Rescue Plan Act, it's going to be cheaper in many cases, depending on income, but in many cases for the employer to allow the employees to go into the marketplace and get coverage. You do not want to lose your clients, your group clients. You want to make sure that you take care of this for them. Also, create a special enrollment period opportunity for certain low-income consumers. So we're not sure what that would mean. And expand the duties of our friends, the navigators. So let's expand their duties. Let's give them more money. And every report that you ask for anybody to run, you'll find out that the money divided by the amount of claims, amount of people enrolled is astronomical in comparison to what agents and brokers can do. Agents and brokers are, licensed, educated navigators. They're a little handicapped, hindered, because they don't have the experience that we have. Now, if they stayed in their lane and they simply did Medicaid enrollment, things like that, consumer education, that would be wonderful. If there was a way for them to work in tandem with the agent and broker industry, that would be wonderful. Give them as much money as you want to give them, but don't put them in a position to compete with the agent and broker industry, which they continue to do. So the roles are going to be expanded. What that looks like, we don't know. They've already given them more money than they've ever given them recently. So we don't know what that's going to look like. Proposed rules, read about it. It's there. So I'm almost where I was the first time that I recorded and didn't have it pushed, nor was I recording. The first time I was trying to record and I didn't record. Anyway, it was wonderful reaching out this Monday. Don't forget about our Power Hour on Wednesday. Don't forget. Power Hour, 2 o'clock Central Standard Time. Opportunity for us to have our monthly meeting where people from all over dial in, and we get updates about what's going on, and we talk about things that we can't talk about in public. So we just have a secret meeting for HAFA members. So make sure to put that on your calendar, save the date. If you need me, please reach out. Send me an email. I'm doing the best I can, but I think I can do it pretty well on my phone. But anyway, have a wonderful, wonderful week. Proud and honored to represent the HAFA freedom fighters, the cream of the crop, the best of the best. Love you all. Talk to you soon.